Alright guys, in this video we're going to start off with the oral cavity for your digestive system. So the first term you need to know is the tongue. So the tongue is right here. So this model is obviously cut in half, so you can see the tongue right there. Gingivae is just a fancy term for gums. So we're going to use this model right here to show you. You can see the gums right here, just below the teeth. So those are the gingivae. Then you have teeth. So teeth in general, you can see some teeth right here, but we're really going to go in the next section into more specifics. You probably won't see the term teeth being tested. You'll probably be tested on the specific tooth types. Next we have the hard palate and the soft palate. So right here, the roof of your mouth, okay, you can see the roof of your mouth right here. The hard palate is going to be the portion covered with bone, okay? Then the soft palate is where you see the tissue change right here. And then the very edge of the soft palate is going to be your uvula. So uvula at the very edge, that's the thing that dangles at the back of your throat, uvula. Then you have soft palate up here and hard palate when you see bone again, okay? Next we have our salivary glands. So in your salivary glands we have a specific model for those. I'm going to bring in this guy, okay? So this is your salivary gland model, okay? Bring it very close. So directly in front of the ear, we have the parotid salivary gland. Directly underneath the tongue, we have the sublingual salivary gland. Directly underneath this cut mandible, you have the submandibular salivary gland. And they also have ducts. So the parotid duct comes from the parotid salivary gland right there. The parotid duct just drains anterior or forward. And the submandibular duct is down here, that little green line, connecting the submandibular salivary gland to the sublingual salivary gland. So this is the submandibular duct. Alright guys, in this section we're going to cover the specific anatomy of the teeth, as you can read right there on your screen. First we're going to cover the regions of the tooth. So the top region, sitting above the surface right here. Okay, so you see it sitting above the surface of the gingivae. These pink things are the gingivae. This is the crown of the tooth, normally what you can see. Where it starts to narrow, right there, is the neck of the tooth. And then if teeth were to have legs, you can see them extending downward. These would be considered the roots of the tooth. So crown, neck, or the narrowing, and the root of the tooth. Next, root canal is a specific term for this space right here that runs through the root. So the specific space that runs through the root is going to be the root canal. Apical foramen, we're going to go in here. Apical foramen is this opening. At the very bottom you see all these vessels traveling in and out of the tooth right there. That is the apical foramen. Next we have the three layers of the tooth. So we're going to back out right here. This top white layer, or white for most of us, is an enamel. Okay? So this top layer right here is the enamel of the tooth. This right here, this yellow layer, yellowish layer that you can see all the way around, that is the dentin layer of the tooth. And you see this thin blue, come in here a little bit. You see this thin blue right there, connecting the tooth into the gums? That is the cementum layer. I think of it as it's cementing the tooth into the gums. So cementum layer is that thin blue layer. Then we have a couple more terms. You see this space right in within the dentin right there. That's the pulp cavity. Then we have our periodontal ligaments. So ligaments connect bone to bone, and teeth are bones. So see these white lines, okay? These white lines are all periodontal ligaments connecting the tooth into the skull or the mandible, depending on which side they're on. Then we have specific tooth types that you need to know. You need to know incisors, cuspids, premolars or bicuspids, and molars. So 4 specific types you need to know. So you see the 4 different tooth types right there, the incisors, the bicuspids, the molars, and the cuspids. So the cuspids and bicuspids are mainly talking about the points at the top of the crown. The incisors are very sharp, okay? And then the molars are more broad, and you see they have multiple roots, okay? So you'll be tested on this model, most likely. And there you go for the different tooth types. So that's it for this section on the specific anatomy of the tooth. Alright guys, in this section we're going to quickly review the 3 different regions of the pharynx because it's shared by both the respiratory and the digestive system. So if we look at this guy again, okay, we see this part of the pharynx that is behind the nasal cavity, that's the nasopharynx. This part of the tube right behind the mouth is the oropharynx, and then if you go down further, this part of the pharynx behind the larynx is the laryngopharynx. Okay, so that's it for the quick review of the regions of the pharynx shared by both respiratory and digestive. Alright, what connects the oral cavity and the pharynx to the stomach? It's going to be this structure right here called the esophagus. So you see the esophagus right here connecting from the pharynx down to the stomach. And then we're going to jump right into the anatomy of the stomach. So with that, I have this stomach model right here. Okay. So this would be, the top part right here would be the esophagus still. And within the piece connecting the esophagus to the stomach, right there, okay, is a sphincter. That's called the lower esophageal sphincter or cardiac sphincter. So that's what fails oftentimes when people get heartburn. Okay, that it gets a little bit leaky and acid will leak back up into the esophagus, giving them that heartburn feeling. So the anatomy of the stomach itself, we have a couple regions of the stomach that you need to know. Okay, so we come in right here. So you see this smaller curve right there. That's the lesser curvature of the stomach. Out here you have the greater curvature because it is a greater curve. Okay, if it's sitting inside someone's stomach, it's sitting like this actually. So I used to always think the stomach was this entire thing, but that's the abdominal cavity, and the stomach sits right here. Okay, so the lesser curvature is going to be medial, greater curvature is going to be lateral in anatomical position. Next we have the cardia. Okay, so the cardia is directly when you enter right here into the stomach. Okay, so it's right underneath where the cardiac sphincter is. The fundus is kind of over here. So the fundus is this top part over here. The largest region is the body of the stomach, and the body of the stomach is what you would think of as this major portion of the stomach. And then you see the body of the stomach right here start to curve in. This is the pylorus region of the stomach, and the pylorus region of the stomach leads us to our next term, pyloric sphincter. So the pyloric sphincter right there is at the end of the pylorus, and it is shooting chyme from the stomach into the small intestine, specifically the duodenum, which we're going to cover in a second. And the last term you need to know on the stomach for now is rugae. So rugae are all these folds on the internal portion of the stomach. Okay, and that's it for this section. Alright guys, in this section we're going to do a quick overview of the small intestine. Okay, so it has 3 different regions, the duodenum, the jejunum, and the ileum. Okay, and then we have one more term to cover. So you see the small intestine cut open right here. These ridges right in here are the plicae circularis, so that's where it can be tested on the model. Normally it's tested on the cadaver though, so ask your TA or lab instructor for help with that term, but that's where you can see it on the models. Plicae circularis, many villi make up those plicae circularis, and we're going to cover villi in the next section. So for now, what are the 3 regions of the small intestine look like? So we're going to take off this piece of the large intestine so we can see what's going on here. So right in here, okay, connecting from the end of the stomach right here into the first region of the small intestine is the duodenum. This is the duodenum. So remember we have the pyloric sphincter connecting into pyloric sphincter right here, connecting from the stomach into the duodenum. Then the next section and all this jumbled mess is jejunum, so that's the middle region. And then way down here, you can see it connecting into this pouch, which we'll cover in a little bit, called the cecum. Connecting into that pouch called the cecum is the last part of the small intestine, which is the ileum. The specific lengths and those kind of things, you can ask your TAs for help on that. But duodenum is the first region, jejunum is in the middle, and ileum is ending it, connecting into that cecum. So. Alright guys, in this video we're going to cover some histology and organization for the small intestine and the stomach. So just for the record, this model right here is a intestine model. And I'm going to use this stomach model to cover the histology portion for the stomach. Okay? There is some overlap, but there are a lot of specifics just for one or the other. Okay? So I'm going to cover this intestine model first. So everything exposed, and this would be exposed to the lumen or the opening, is everything down until you reach, and including this red, all the way up, including this red, is all the mucosa layer. Within that mucosa layer, we have many different specific layers. The mucosal epithelium is the exposed portion just right there. It's the mucosal epithelium. Then we have the lamina propria. So the lamina propria is this part of the mucosa. So this is the lamina propria. You see it mainly covered by structures. All this behind all these blood vessels is the lamina propria. So this is the mucosal epithelium, lamina propria, and then that connects to this red right here. And so that red is going to be the muscularis mucosae. That is the last specific layer of the mucosa. Then we have a couple structures you need to know within that. So we have the mucus or goblet cells. So those are where you can see the indents within the cells right here. Or you can look down here, so like this is kind of hilarious. So they blow up this part of the epithelium. It's like a magnifying glass. And then these indented cells are the mucus or goblet cells, those light blue. So if you can't see them that well, right here, the indents, mucus or goblet cells, look down to this zoomed in version of the mucus or goblet cells there. Next, we have an intestinal crypt. So an intestinal crypt is just where you see the mucosal epithelium dip down here. So you have two of them right here, intestinal crypt. Okay? So next layer down, underneath the mucosa, specifically the muscularis mucosa, is this lighter submucosa layer. So sub means below, so this is the submucosa layer. Then you have the muscularis externa. So the muscularis externa includes both of these red layers. Okay. So part of the muscularis externa is broken up into two specific layers. You have the circular muscle layer right here, and then you have the longitudinal muscle layer, which is out here. Okay. Underneath the longitudinal muscle layer is going to be your serosa. So serosa is this bottom portion right there, all underneath it. Okay. Then we have a couple more specific terms that you need to know for the intestine. They have intestinal villi, which here's a villi, here's a villi, here's a villi in the background right there. Okay. Lacteal is this white structure right here. So fats are too large to absorb directly in the bloodstream. So we absorb fats in our villi through these lacteal structures. Then we have our capillary network, which just sits right here on top of that lamina propria specific layer of the mucosa. Okay, and that should be it for the intestine. So let's flip to the stomach model to understand those same layers. So now we're going opposite from outside to in. This white is all serosa layer. So you see a bit of the serosa covering that pylorus region right there. Then we have along the greater curvature, and pay attention to striation patterns. You see the striation patterns right there. That's the longitudinal muscle layer of the stomach. Then it changes and you see it curving where it would go in a circular motion. That's the circular muscle layer. And then unique to the stomach, underneath the circular muscle layer, is the oblique muscle layer, which has diagonal striations. So this is the oblique muscle layer, and that is unique to the stomach. In this section, we're going to cover the anatomy of the large intestine. So earlier we covered the small intestine. And the end of the small intestine is the ileum, right? So we have the ileum dumping into that pouch called the cecum that we talked about earlier. What connects the ileum to the cecum? Good question. That is the ileocecal valve. So this little valve right here is connecting the ileum to the cecum, ileocecal valve. Okay? Hanging off the bottom of the cecum is this little finger-like structure right here. That's the appendix. The appendix. Then we break into the regions of the large intestine. So the first region you need to know bringing it up is the ascending colon. Ascending colon coming up from the cecum. Then this bend right here is the right colic flexure. Right colic flexure. So that's connecting the ascending colon to the transverse colon. So this region is the transverse colon. Then when the transverse colon hits the other edge, okay, over by the stomach, this is the left, so let's turn it this way, this is the left colic flexure. Left colic flexure, it's anatomically on the left side. That's connecting the transverse colon to the descending colon. Descending colon. And then at the very end, you'll see the descending colon kind of in line, parallel with the other side. Okay, it starts to bend towards the end. This bend towards the end is the sigmoid colon. Sigmoid colon. And that is going to feed us into the rectum. So the rectum is this about 6 inches right here. This is a pouch that expands and tells your brain it's go time to go poop. Okay. The opening to the outside world is the anus. Okay. The anus. Okay. And then the muscles right here are the internal anal sphincter, and the external anal sphincter is out there. Okay. Now for those, okay, internal is involuntary, external is voluntary. So you can hold it to an extent. Next, we have a couple terms that we missed. Okay. The haustra are these outer outpocketings or pouches within the colon. So every time you see it bulge, that's a haustra. Running throughout the colon is this white band of tissue known as the tyae coli. Tyae coli, and that runs throughout the entire length. Next section we'll cover accessory structures that help you digest food particles. Alright guys, so in this section we're going to cover the anatomy of the liver, one of the accessory structures of the digestive system. So the first thing we cover is on the front part of it, okay? And you see this kind of stretch right here. That is, it should be white, but it is discolored right here. This is the falciform ligament. Connects the top part of the liver up to the diaphragm. Okay. Next we have the round ligament, which you can see it dangling on the bottom right there. Okay. Round ligament. Okay, so that's on the bottom end of it. And then we need to make sure this is an anatomical position. Okay. So an anatomical position, all right, looking at the back end here, we have the vena cava, okay. The front side, okay, you should have this little green pouch, low riding. It's a G, so it's on the bottom, okay. So this very large lobe on the right side in anatomical position is the right lobe. This smaller lobe on the left side is the left lobe of the liver, okay. Then if we look internally, okay, you see right next to this green structure you have this kind of quad area. That's the quadrate lobe. Quadrate lobe sits next to this green structure, and that green structure is the gallbladder. So it's GQ and it low rides, so it's pretty cool. So G, gallbladder, is right next to the quadrate lobe. And then up next to your vena cava, and specifically the inferior vena cava, is this lobe that's doing its own thing on its own, okay? That is the caudate lobe. Caudate lobe. So caudate lobe is next to cava. So caudate, cava. All right. And then within it, you have some hepatic veins that feed back into the inferior vena cava. And then we have the hepatic portal vein, which is that purple vein right there. Hepatic portal vein. Proper hepatic artery is right here. And that came from the common hepatic artery, which we cannot see on this model. Next, we have a couple ducts that are specific for flow in and out of the gallbladder. So in and out of the gallbladder, this is so this produces our bile, and then the gallbladder stores it for us until it's time to shoot it out. So gallbladder, coming directly off the gallbladder, we have the cystic duct. So the cystic duct comes off the gallbladder, cystic duct. All of these little guys coming directly off the liver are the common hepatic ducts. And when they merge, okay, so you see this merge right here between the cystic duct and the common hepatic ducts, they form the common bile duct, and that's what actually leads into your pancreas and shoots into your small intestine to help you digest specifically fats, okay? And that should be it for the digestive system. You're welcome. Just kidding. Okay, so in this video we're going to cover the anatomy of the pancreas, as well as some of the structures that hold your digestive system or bowels together. Okay, so I am going to go run and get you a pancreas. Okay, so we have a pancreas right here. So you can see right here, this guy is a spleen, so don't worry about it, part of your lymphoid or lymphatic system. This part is the duodenum right here. Okay, this piece all in the middle is your pancreas. Okay, so within the pancreas we have the pancreatic duct and accessory pancreatic duct. So the pancreatic duct runs throughout the whole thing and goes downward. So it runs throughout the whole thing, goes downward. This little piece at the end that goes high or goes higher than the pancreatic duct is the accessory pancreatic duct. Not all of us have them. And then the last term you need to know is duodenal papilla. So duodenal papilla, let's see if it looks a little better on the other model. Okay, excellent. So we can see at the end of the pancreatic duct right here, it opens to the small intestine, and that opening right there is the duodenal papilla. So that's the actual opening from the pancreatic duct into the small intestine. And interesting enough, if we see on the back side of this pancreas, you see this little green vessel right there? That's an extension of the common bile duct, bringing bile down to excrete out into the small intestine. How cool is that? All right. Another couple things. Okay, or essentially just one more thing that you can actually see on models is the greater omentum. So the greater omentum, you'll see right here, I call it the fatty padding. Okay, some of us have a little more than others, okay, working on it. But we have the greater omentum right here, okay. That essentially holds all of this stuff in place and insulates all the intestines you can see right here. So, greater.